grew up in DC. I loved biology, went to Stanford Medical School, went on to do surgical residency in head and neck surgery, climb the ladder, do what every good medical student and resident is supposed to do, climb the academic ranks, publish papers, etc. And so I was heads down in that journey, and like there was something inside of me that was whispering and then speaking a little louder, and then finally was a deafening call to me that like something is not right. Like I'm working 80 hours a week. I'm operating, 2, 3, 4, 5 surgeries a day. And, in some ways I feel good about that. People, maybe their sinusitis is a little better for a little while. But fundamentally, when you pop up for just a second, which they don't want you to do in healthcare, everyone's working their tails off. But when you pop up for just a second and look around at what is happening to American health, children's health across the lifespan, as well as global health, it's a disaster. It's literally a disaster. And again, people will say that's alarmist, but in trying to understand, like, why don't I feel right about my work? I just started looking at the data in a different way. And I started to look at what was happening with health trends. And if you just kind of run through the list of what's happening, it's unbelievable. Like we are getting destroyed, and it's very recent and it's accelerating. The stats speak for themselves. You know this very well. 74% of Americans are overweight or obese. 50% now of American adults have type 2 diabetes or prediabetes. These were diseases where there was 1% of Americans in 1950 had type 2 diabetes. Now it's 50% of Americans have prediabetes or type 2 diabetes. Alzheimer's, dementia are going through the roof. Young adult dementias have increased like 3 times since 2012. So early onset dementias, we're seeing, this 1 in 2 Americans are expected to have cancer in their lifetime now, 1 in 2, and young adult cancers are going up 79% in the last 10 years. We've got, of course, the autism rates are absolutely astronomical. 1 in 36 children has autism now in the United States. That was 1 in 150 in the year 2000. And in California, where I live, it's 1 in 22 with a lifetime neurodevelopmental disorder. We've got infertility going up 1% per year. 25% of men now under 40 have erectile dysfunction. A quarter of the country. This is fundamentally a metabolic disease. We've got 77% of young Americans can't serve in the military because of obesity or drug abuse. We've got autoimmune diseases. Some studies are saying they're going up 13% per year. It's really unbelievable. And I could go through so many more diseases. Of course, we've got heart disease, which is almost totally preventable as the leading cause of death in the United States, killing around 800,000 people per year. And I think as I kind of just looked around, and again, these are just statistics, I started trying to put the pieces together. Why is this happening? Why are these all going up all at once? And that led me on what is now a 7-8 year journey, ultimately leaving the surgical world, putting down my scalpel forever. Because what I realized is that when you go to the science with a root cause perspective, you go back to PubMed with a slightly different perspective, not how do I treat these diseases once they emerge, but why are they happening? You see a very obvious, blaring answer, which is why we had to write a book about it, which is that it's all caused by metabolic dysfunction, a term that I never learned in medical school. I learned about metabolic syndrome and the different individual diseases that make it up, but there is a problem. There is a fundamental breaking of our core cellular biology that is caused by our diet and the world we're living in, the modern world we're living in today, that is crushing the very way that the human body and our human cells can transmit food energy to life energy, to cellular energy. And so our bodies are essentially, fundamentally, because metabolic health is how we make energy in the body, the way that our environment is now synergistic to restoring our metabolic health, and the science is very clear about this, it's basically like all of us are a little bit dead while we're alive. That's what metabolic dysfunction is. It's less energy in the body. We're underpowered. And that's very dark. Like when you step back and say, okay, this is clear from the research, and I never learned it. I didn't learn it at Stanford Medical School. I didn't learn it in my surgical residency. And we could fix it. We could fix it really quickly if we all popped up and woke up and looked at the data and put pieces together. But of course, we're not trained to connect dots. That's not our job in medicine. We are trained to follow algorithms and to be reactive. And so I think, just to sort of kind of back up to the bigger picture of why we're so passionate about this, I think that the reason there's a Maha movement, the reason that people are so passionate about your podcast that talks about this so much, people know that something's not right. And people know that this health issue is the tip of the iceberg of what's actually happening in our world today. It is a reflection. Our human health is simply a reflection of the destroyed ecosystem of our globe. The fact that we have forgotten that we're completely connected to nature and we're completely interdependent with nature, but the health crisis is simply a reflection of a destroyed ecosystem, and humans have become so powerful and so technologically advanced and so connected in the recent decades that we now actually do have the power to both destroy the world and destroy our health. And the health is just the tip of the iceberg of a much bigger thing happening that is existential. And I think we all want kids to be healthy. We all want humans to be healthy, but this is also, it's interconnected with all the systems and all the issues. And I think it's hard for people to totally articulate that, but that is what's happening. And we actually have a choice right now. And I do believe this is the moment that we need to decide, are we going to address these interdependent issues? And are we going to make the effort and be courageous enough to fight for this? Or are we going to let ourselves be told that there's nothing wrong, nothing to see here, while our health and the health of the planet is just absolutely being destroyed? So that's what our mission is.
I think one of the most disturbing things about it is how few people are speaking out when the data is so obvious. And then when you guys lay it out, and when people like Brigham Bueller or Andrew Huberman, when any of these people that are like very focused on what the problems are lay it out, the data is all there. But yet we're not being told this anywhere other than the internet.
Right.
It's only independent shows that don't rely on executives and networks where there's pharmaceutical drug companies advertising, or food companies, or any of these things. You don't hear any of this stuff. It's a human issue, and the fact that people are willing to take money to not talk about one of the biggest problems that we have. I didn't even know about the childhood dementia thing or the young adult dementia thing.
Well, type 2 diabetes used to be never seen, among kids in their career.
Right.
It used to be called early onset. They don't call it early onset anymore. As Casey said, 33% of young adults now have prediabetes. I mean, this prediabetes is not some isolated thing. It's the branch of the tree. It's cellular dysregulation. And every single disease is going down. Alzheimer's is now called type 3 diabetes. If you don't have prediabetes or diabetes, you have a very diminished chance of having Alzheimer's. And, so it makes total sense. But somebody from Harvard Medical School that specialized in Alzheimer's, their entire course load, their entire training, their entire focus is on accepting Alzheimer's, that it's there, that it's growing, and then figuring out marginal improvements for it. There's literally people that are the highest educated people in the world do not even understand what causes these diseases. They're just accepting that and making the cures for them, the marginal treatments.
And I would just say also, like, if you do step back and look at everything holistically, like, one of the biggest problems with the healthcare industry right now is that it's so siloed. We have over 100 different medical and surgical subspecialties, and the business model of American healthcare right now is volume. It's how many people can you see, and so that's what you get paid for. You don't get paid for outcomes, you get paid for volume, and so that has incentivized a structure of healthcare where it's most profitable to actually be seen by as many specialists as humanly possible, and that's what the average American is dealing with. They go to the primary care doctor with a list of issues, and they get 8, 10 referrals, and they spend their life going through revolving doors of these different healthcare offices and not actually really feeling better, and they feel disappointed, and that's why I think people are frustrated. So we've got all these doctors who are incentivized to really be head down in their specialty lane and not actually step out and look at the big picture of how things are connected, when in fact it's all connected. We don't see the body anymore, and I'm just telling you this from like sheer experience of being in medical school. Like, we are not trained to see the body as a unified system. We're trained to see it as 20, 30 different parts. And so no one's seeing the forest for the trees. But like Kelly's saying, like, look at what's happening. Like, you look at what's happening with kids. We've got ADHD through the roof, autism through the roof. These are neurodevelopmental issues. Then you look at midlife. Well, women and men are depressed. We have huge rates of mental illness.
25% of women.
25% of women now are on SSRI. I mean, we're living in like the wealthiest, safest country in human history, and 25% of people are on an SSRI. That's insane. Then you go into menopause, perimenopause, that age group, and it's sort of brain fog. And then we have full-blown Alzheimer's going up. So we've got all these neurodevelopmental issues and neurodegenerative issues sort of across the lifespan. And, you know, then you look at kind of the hormonal side of thing. We've got girls going through puberty much earlier than they ever were. You know, we are of continents on Earth, we are the earliest puberty rates right now. That's gone down on an average 6 years since 1900. Our puberty rates are way earlier. So girls are reaching sexual maturity at like age 10.
They're getting pubic
Then
hair.
you've got, in midlife, you look at women, and infertility is through the roof. We've got PCOS is affecting 26% of women. This is a metabolic fertility issue. It's a leading cause of infertility in the country. Then we look at older age, and like menopausal symptoms are a disaster for women. This is why a book like The New Menopause was like the #1 book in the country for a while, because women are desperate. So if you step back and look at all these different things, we've got these neuro issues throughout the lifetime, all exploding. These hormonal issues throughout the lifetime, all exploding. It's happening all over the place, but no one's stopping and asking why. Like, why is this happening? Instead, we put ADHD in a bucket. We put depression and anxiety in a bucket. We put Alzheimer's in a bucket. And so that's really the problem. And I think, you know, when you think about some of these things, it's like we're becoming infertile and we're losing our minds across the lifespan. Like, what the hell is happening? Like, that's what these diseases, these buckets of diseases represent. And I think that's why I think it's, you know, we talked about like it's the tip of the ice. Health is the tip of the iceberg of fundamentally like a planetary issue. But like the planetary issue is the tip of the iceberg of what I think is really, really going on here, which is like a spiritual issue. Like we are like not fighting for life in this world anymore. And I think that's more of a consciousness issue. You know, we talk about why is no one covering this? Da-da-da. It's like, I think people see it. I think in some way we have like totally lost respect for like the miraculousness of life. That's what our actions are reflecting. Like, we know a lot. We have the technology, the money, and the resources to fix all of this, the planet and health, and we're not. And that's why I think there's something darker happening on like the consciousness level. And I think we could get our way out of this if we, like, I think it's going to be hard to get our way out of this if we stick to like partisan politics and quibbling about individual policy ideas. I think it has to start with like, are we committed to life and to awe and to connecting with source and then listening and moving our way out of here, or are we not? And if we choose not, which is what I think we're doing, I mean, I think there's huge light happening because that's why everyone's interested in this. That's why a lot of people are interested in this issue right now. But like, if we don't, like, I do think we're on the road to existential disaster because we're that powerful now. Like so, you know, I think step one is us deciding like what choice do we want to make in this lifetime? Do we want to believe that humans are that life is a miracle? This universe is a miracle. Our bodies are miracles, and we want to connect with God in this lifetime. We want to build and respect these temples that are interconnected with the earth to do that, or do we not? And like, that's the choice we have right now. And I think we have to take that very seriously. And I think a lot of the political stuff that's happening, Maha, it's all just a reflection of people wanting to find a way to fight for life on the biggest level. Like, that's what I think is kind of happening.